Oh, little Skylet. Oh, she's gonna wedge it back there. I can't reach this any closer. There's her little snout. I'll be back in a few minutes. I'm gonna get meds ready and stuff. She's so cute. Maybe she'll get in her nest while I go get her some snacks and stuff. Hello, Skylet. Let's see, how are we gonna do this? This preventer for little wormies. Okay, so we'll see how this goes. Hello, little beautiful little Skylet. You're so beautiful. Let's see if I can entice you with some treats. Let's just see if we can make any progress here. It's time for her meds, so, and then we can talk about her future. Do I this as a treat? Normally with the feral cat, if you stick your hand into their lair, your hand will get smacked or bitten. So don't try that with any feral cat. Do you want a snack? It's pretty tasty. You should try it. You know you want to. We usually have to reestablish trust when I come back in. Yes, because I'm still scary. I'm still scary. I know, I get it. You know what though? You really like these. Try this, it's really tasty. Very tasty. Can I give you some pets? No, she says nope. No, thank you. She's like a brontosaurus. That's some very thorough sniffing she's doing. Are you gonna eat it? I bet that's very hard to see because it's no contrast between the wood and the treat. So let's see, what do we think about this? What do we think is the best way to access you? She's in the Lego castle that I built. She still hasn't been up here, but I'm not actually that surprised. I'm surprised, but no, with her vision, I'm not that surprised. The more I learn about it. So what do you think? Do you think we should pull this out a little bit and then we try to just use our blue blanket friend to do a little wrap up? What do you think about that? We just pull this out a little bit. Too bad my step stool's not in here anymore. Or I could potentially, I wonder if I put this back here. What I'm trying to do a lot with her is figure out ways to contain her that are the least stressful. I don't, you know what, if you go that way, I'm bearing treats, but if you go backwards, you go right into the blanket I put there for you. And then I can just pick you up. She looks like she's getting comfy. I can reach through the top here. I don't want to startle you. Hi. Oh, that's nice, huh? There we go. That should do it. Now, of course, I have to get up there. And then I have to get back down here. Out. Okay. This is totally gonna work. Oh, I forgot to move out back there. Perfect. Okay. Perfect. Girl. Perfect. Alright, I gotcha. I gotcha. Okay. Oh, there. Perfect. What a good girl. Okay. Voila. Voila. Such a good girl. Okay. It's nice that she hasn't made me chase her around the room. Oh, your face is out. I didn't even stay put. What a good girl. What a brave girl. I'll make my lap hole bigger for you. And I need to get the meds. Yeah. And I'm going to put her drops in so the clock can start. Now we need your face though. Sorry, I know. You're so brave and so beautiful. We're almost done with these drops. This is our last application of the serum that was made from her own blood. All right, you just let that soak in for a bit. All right. So you probably saw, because I posted on Facebook first, that I have officially decided that Skye will not be returning to the forest. She has made such great progress in her first 7 days here. She still has quite a ways to go, but I'm very encouraged by how well she's done and how relaxed she is and how tolerant she is of me doing things to her. And so that's a big part of it, but also Dr. Ferguson heard back from the specialist, who doesn't think that we are likely to be able to reduce the amount of scarring and opacity, which means that she's always going to have pretty poor vision and not be able to judge depth perception very well. And so if she had one really good eye and one bad eye, that would be different. We do have 2 cats out there that we removed really damaged eyeballs, and they're doing just great. But I think it would be a challenge for her, because the scarring in her right eye is, oh, it's purring. It's nice. Is kind of up into the right of her pupil, so it's obstructing it. It's, even though it's smaller, it's still obstructing quite significantly. So she's probably never going to have really wonderful vision. Purring. So you can see that she has tremendous potential. She still gets nervous though, but she hasn't been aggressive to me. Thank goodness, because otherwise I don't know what I would do. But I'm hoping that we can keep her eyes from getting worse, at least, so she'll have some vision, and she should be able to adapt just fine in a home. I'm going to look for exactly the right match for her though, so that's why I decided to start now, because it's may take a while to find the right home. Because she will have ongoing special needs. She'll need a house where people don't rearrange the furniture all the time. I would say no kids. I think she would do okay with other cats as long as they're friendly. And a quiet home where she'll get lots of love and attention, and someone who's going to be able to commit to her for the next 15, 20 years and make sure that she gets the vet care she needs when she needs it, and is fully prepared to take on the whole package, which is going to include not only the medical care, but she'll also continue to need socialization and trust building and all that stuff. So she's not going to be ready to go home for probably 8 to 12 weeks, I would say, depending on how things go. But like it's purring, but it may take us a while to find the right person for her, so may as well just make a decision and get on with it. She's doing remarkably well, I think, in captivity, and so I'm satisfied that she's not going to be harmed by keeping her indoors. And in fact, I think she will actually, once she's had a little more time, I think she'll actually be very, very happy. She's purring. You can hear her purring. Too bad the camera won't focus on her. She's so pretty. So it's only been 7 days that she's been here, and she's already purring and really enjoying being petted and taking treats from me. See if I can get the camera to focus without moving my hands. Nope. Oh, there it goes. Yay. There you go. She looks like a bunny. Do you look like a bunny? Are you a bunny or a feral cat? Can you believe that she was living in the forest completely feral? Never knew the love of a human 7 days ago? Such a good girl. So, if anyone knows someone who might be a good candidate and fall in love with her, then send them our way. tinykittens.com/adopt. They will need to include in their application that they'll need to be able to illustrate that they understand that she is formerly feral, and what's entailed and her medical needs, and that they're financially able to take this on, and have a long-term plan for her, and will be able to care for her for the next 15 to 20 years. I am going to be very picky about that, just because adopting out a special needs cat, you just would hate it if something were to happen and there was no plan in place. 5 years from now, she'd end up in a shelter getting euthanized. If there's no plan in place for something, if some sort of emergency or catastrophe happened. So I'm going to want someone who's got a sort of a long-term plan, and can guarantee that she's going to get the care she needs for the duration. So So, that's the plan. That's really exciting news. It's very exciting for her. I'm very excited. Listen to those purrs. Yeah, I would think that sending her home with a kitten might be nice. Kitten or two would be nice for her, so we'll see how that goes. I would love to keep her local. It's not 100% a requirement, but it would have to be, just exactly the right situation. I'm not going to turn down a home that's not local if it's exactly the perfect situation for her, but it would be great if she could stay local, localish, within a couple of hours. Washington, kind of like in the area. So, and then we all also need to be prepared that when the kittens come, if she turns into super ferocious, protective mama, that doesn't mean that she can't be socialized once she's done with kittens. It just means that she's being a good mama the only way she knows how. So we won't judge her for that. We will applaud her for that because she's being a good mommy. But ideally, I would be able to continue her treatment when the kittens are born. I don't know if that is realistic. It's probably not very realistic, but we'll just have to see. Yeah, I mean, I can guarantee 100% that she and her kittens would not have survived. She can't protect herself. And even though we're feeding her, for her to leave her kittens to come out to the feeding station to eat, and then having to wait her turn because she's not, she defers to the other cats because she doesn't want to start trouble. And then by the time she gets back to her kittens, and then her eyesight's getting worse, and predators and cars, and there's no way that they would have survived. So she needed to come in. This is her only chance. But it worked out. Yeah, predators would pick her off first. I mean, if she can't see, I just can't imagine that'd be awful. So, she definitely can still be a successful mom. She does have some vision in her right eye. It's just obstructed by the scarring at the top of her pupil. But she can see to some degree. It would be like if you cover one of your eyes and then like make a fist and cover the top part of your field of vision and the uncovered eye. That's kind of how she sees. So it's monocular vision, so not good depth perception and obstructed. But she can see around it. And I think her instincts will kick in. And I'm hoping. I don't think this is her first litter, so hopefully she will know what to do. A pretty good purring there happening there. Oh, there you go. What are you trying to sleep? She does. She moves her head to to try to navigate around her blind spots. Don't you? You're very well adapted. And she will be able to adapt in a home, no problem. They'll just have to, oh no, you can't leave yet. I know, you're not leaving yet because we have to do more meds and stuff. Oh, I know. I doubt that I will be able to assist her when the babies are born. I'm hoping that I will be able to come in after, but where you go? Oh, because you know I'm going to have to just grab you again. Where are you going? This is her new thing where she leaves me halfway through. It's so pretty. Oh, do you want some snacks? How about snacks? Nick, how about some snacks? I bribe you with snacks? Here. I know you like snacks. It's right here. That's a good girl. So she eats in front of me. That's really good. I'm going to try to move this without making her too nervous. This is a big step for a feral cat, just eating so close to me. So with a few modifications in the home, she'll be able to completely adapt to her vision loss. So, you know, like I said, furniture, if you're going to move furniture around, you kind of have to introduce her to that and get her used to it so she's not bumping into things. She's not completely blind though, so, and she has navigated this room pretty well. She's not great at jumping up and down. So I have like steps for her to get up to everything. And this countertop is good because it has the edge is defined with another color, so there's some contrast there. She likes snacks. And so, I mean, this is only 7 days in, so if you remember back to like mistletoe, she would do okay in the lap, and then as soon as she got up to leave the lap, she would get really nervous and run away fast. So they all kind of react a little bit differently, but the fact that she's eating right next to my knee is good, and I probably give this to her, and she says okay. Gotta feed those babies. Her breathing is good, nice and relaxed. Her belly is getting pretty big. I don't think we can predict only 7 days in whether she will or will not be a lap cat. I suspect she will become quite affectionate. But she could be wanting to leave my lap for any number of reasons. I could be smushing her bladder. She could be hungry. She could be uncomfortable. She could be nervous. Any number of things. So I don't think that is indicative of her not being a lap cat at some point. I actually think there's a good chance she would be a lap cat, or at least a lap adjacent cat. How was the no force determination made? It was a combination of her progress, and that she hasn't been aggressive toward me, and then also hearing back from the specialist that the scarring and opacity is unlikely to improve, which means that her vision, I wouldn't be super comfortable sending her back to the forest with her vision impaired to the degree that it is impaired. I don't think it would be safe for her. And then also the possibility that if she gets ulcers in the future and they're untreated, then she would have more scarring happen, and so she could end up losing her vision out there in the forest. So since we are making such good progress with her, and since I don't know that this is a problem we can solve completely, and then I think it's quite clear that finding her a home is the best course of action. So we just have to find the right home for her. Just have to find the right home. Oh, it's so good. You're so round in your belly. I don't know about her left eye. We may end up removing it at some, like when she gets her spay, because it is bulging, and I don't know if we can. I don't know if that will be resolved with treatment, but we're treating first, and then if we have to take more drastic action, we will. Like if it's bothering her. The really good thing is that she doesn't have a bunch of discharge from her eyes. She's not always rubbing at them. She's not avoiding light. So I don't think she is actually in a great deal of pain. And the fluorescein test that Dr. F did during her exam showed that she doesn't have very much active ulcering on her corneas right now. It's mostly the scar tissue that has accumulated from this being such a chronic problem and not getting treatment. So I'm hoping that her pain level is pretty good, and so there's really no downside to trying to treat both eyes while we wait for babies, and hopefully we can just wait until her spay and see how the treatment has gone, and continue to consult with some specialists and see if there's anything else we can try. The specialist didn't seem to think that there was a particularly good option for trying to surgically remove the scar tissue. But we will just see how things go, and we will explore every possibility. But at this point, hello, you're so hungry. I'm glad you're having a good snack. You're taking it ready to go. You don't have a sort of obstructing your egress. So, just keep her in mind if you hear of anyone who's looking for a very special, exceptional cat. There's lots of time to get to know her. She'll be here probably for, I would say, at least 8 weeks. I'm hoping that I wouldn't have to early wean the kittens, but no way to know for sure. She will be staying in this room because it's small, and she can learn the layout and be comfortable in here. So this is actually a really good size for her. cats do adapt really, really well to being completely blind even. Hi. Oh, what a good girl. You're so big. You're a wide-load. Perfectly round. But did I pet? Sometimes I pet you. And you like it. I know, don't pretend you don't like it. Don't pretend you don't like it. I know, you have to get used to me touching you and doing stuff to you. Now where are you gonna go? Yes. Oh. You can go back there. That's a good spot. Look. Oops. Here's some belly vision for everybody. So I have her eye drops, her eye ointment that I'm going to give her in a few minutes. Just have to wait at least 20 minutes between the serum and the eye drops. Hi, beautiful Skye Mama. Skye Mama, do you want more snacks? I'll give you more snacks if you want them. Such a beautiful Skye Mama. So this is her last dose of the serum, but I will be continuing the antibiotic ointment for likely quite some time. We may transition to like an eye lubricating treatment after a course of the antibiotics. I'm not sure, but she will be receiving treatment as long as I possibly can give her treatment. We're dancing like crazy. So I'm hoping we get, so it's been a week, I'm hoping we get at least another week of treatment and socialization with her. That would be ideal. I think I'm going to introduce Gwen to her later this week so that if I need a shift covered, that Gwen will know how to approach her and what to do, and she can cover if necessary. Gwen's very, very good with cats and treatment and all that stuff. I think we need to keep the number of people limited as much as possible, just to keep the stress as low as possible. But if she's if she's definitely going to be going to a home at some point, then introducing a second person will be beneficial. She loves her some sneaky food. Zoom out because you're picking your plate. Because you're so excited about your snacks. I would expect we'll have at least one litter of kittens before this week sometime. So before April 6th. On or before April 6th. I think we'll have maybe Savina kittens. That was quite a snack. Are you going to give us a little burp? His goodness balances out the temptations I gave her earlier. So, things will get interesting around here. I mean, as if they're not already interesting. They're gonna get more interesting. Look how pretty and brave you are. Yes. Savina does not let me near. Savina is actually, I'm excited about how Savina's doing too. I posted a photo on Twitter of her when she was laying on her back, kind of like spread eagle. She's so relaxed and comfortable in her nest. She is the one I was really worried about at the beginning. She was climbing the walls and so panicky. Under that kind of stress, it just increases risks of all the bad things happening. Risk that she would be unable, like too stressed to care for the babies when they come, or even to handle the birth. So it makes me feel a little bit better that she's been so comfortable in her nest. But she does not like me coming close. I have been able to put food in through her trapdoor and take out the empty bowls. So I'm trying to do that to get her a little bit used to that. I don't know if there are kittens there, if she will come after me. But the nest is, I'm hoping the nest is big enough that, and she lays on as far away from the door as possible. I'm hoping that the threat is minimized enough that I will be able to at least deliver some food to her, after the babies are born, but that may not be possible. We'll see. If not, I can always put it right outside the nest. But it's going to be, I think, a challenge to get access to her kittens. I do have so the nest I designed for Savina has like a guillotine trapdoor that I have rigged up to a pulley on the ceiling, and then tied off at the door. So if I wait till she's out of the nest, then in theory I can lower the guillotine door, and then when I open the door she won't go rushing back into the nest. And then as long as there's a place for her to hide in the room and she's not charging me, then I should be able to very, very quickly get in there, grab the kittens, get them weighed and checked really quickly, and then put them back in theory. I don't know in practice how that's going to pan out, but that's what I'm hoping will happen. Because it's been a big challenge in the past when the mom's on the nest to get at the kittens. So we'll see. I don't have that set up with Neelix's nest, so if she decides to guard the kittens, I'm not exactly sure how that's gonna go. I have some ideas, but so there will probably be some trial and error with Neelix. Oh, look at that tongue out. I know a lot of people think that, looking at Skye, that she is not a feral cat, but I'm pretty confident that she was born feral. One reason is that her eye condition is chronic and has been there since she was little, and if she had people that loved her, they would have treated her eyes and she wouldn't be in this condition right now. Hey, you probably want to wait till I put your ointment in to do all your cleaning there, huh? I got some ointment coming at ya. I think definitely each feral cat has their own personality. Like, look at Mr. T and how well he did, and Jingle did have exposure to humans, but his personality was just off the chart social. I think it's a combination of personality and experience. They do see like farm workers around, but most feral cats see humans around, so. And she hasn't been at the feeding station long enough to be familiar with us, so. I think it's just, and I also suspect that, well, I don't know, but I think it's possible that if they come in injured, I think that may have an effect on how they do. I'm not sure if that's true or if they just, the ones we've had in that have been injured have had great personalities. Yeah, so Junebug, who had that horrible eye pus before her eyes even opened, that's a good example of a kitten that oh my god, excuse you, that if I hadn't treated that right away, she certainly could have ended up like this, yeah. And we see many cats at the colony, unfortunately, that have similar eye conditions. We fixed 2 of them, and there are currently 2 other cats. One we've neutered already, and one we haven't, who's kind of new, that have similar stuff going on. So we're always trying to catch those ones. So she's doing very well. So I've got to give her her eye ointment, and I'm also going to do Profender because I didn't do this on intake because I wanted to wait a week. So, but I'm going to do it now because we should be within 10 days of birth now, and apparently if you deworm within 10 days of birth, you will prevent the roundworms from being transferred to the kittens, in theory, which doesn't mean that they're not going to have parasites, but I think we may as well try to give them every possible advantage. So let's see, are we going to do meds in the corner there with you, or maybe we should try that? It's not quite big enough for your large human friend. We'll take the foods away for a minute. And put that there. Get the ointment. Fender. Put this over here. Okay, I'm going to try to approach her. She's suspicious. She knows. Do you like that corner? I know, it's very scary. You're very brave. You're not going to be hungry for a treat right now. Maybe, oh, no, she says no. Oh, I'm going to get a hiss, maybe. Maybe a little hisses from you? Okay, we tried the blanket. So you see that even though you see how well she does, you can see she still has very feral, appropriate reactions to being cornered and being approached. So I'm going to try to get her sort of in this blanket, or get her, but I'm going to try to do it in a non-threatening way. Oh, there we go. And then I can approach her without stressing her out too much. Oh gosh. If I can only fit here without making too much noise. Oh. It's very small. Okay, there, I think we're good. Alright, now, where is these? So I'm just gonna, she's just loosely covered, so I'm gonna just keep her loosely covered so that she feels less threatened. And then I'm gonna try to find her face, which is hiding back here. If she was showing any signs of aggression, then it would be, this would be, finding her home would be very difficult, because I have an obligation to not put people at risk. But so I'm very happy that she has been so good about such invasive and frequent treatments. Okay, girl, you're so special. You're so special. Okay. Good job. Now, one more thing. Then we're done. One more thing. This Profender just goes on you. Safe for pregnant cats, which we like. Just a liquid, and this is a very, very good dewormer that will also get tapeworms, which you want to get, especially when they have fleas, and we know she had fleas, so that's good. A little extra dewormer for you and the babies. And maybe we'll do some petting. I don't think she wants any treats because she just had such a big meal. But I'm looking for some petting. I do think the ointment is soothing on her eyes. It looks so bright, but it's actually not. It's just the camera is overexposing the picture because it's low light down there. He's so good. What a brave kitten. She's so brave. So, very excited. We'll see if anyone applies or if anyone's thinking about it. And we have some time to try to find exactly the right person. Oh, some purrs. I hear some purrs happening. Oh, I feel some purrs. That's nice. Some good purring. She's really got her motor going. Get a meal. She's getting, her eyes are ointed. And then she's getting pets. I'm gonna scoop your stinky poop in a minute. So you wouldn't have to smell poop. It's very stinky. You might have more stinky poop with tapeworms in it. It's good to get rid of all that stuff. So you could be a very special human if you got to have this very special cat in your life. Your life would be very special. Such a good girl. Oh. Such a good girl. Very cozy now. You touched your poop ender. That's what you had wiping off on you. Look at that little face. It's so sexy. Alright. I'm crammed in a very uncomfortable position. And I need to do your poop. So I'm going to need you here. You can snuggle or you can relocate to your nest. Whatever you want. I'll be right over here cleaning your room for you. Oh, if I can get up without causing. Oh, there we go. Oh, she's so cute. Alright. Meds. And this can go here. And that I guess I can put it back now. Okay. I'm gonna close the door and run some water in the sink. wonder if I should restructure this. Maybe I could just, that's a good idea actually. It's okay, I'm just talking to myself. I'm going to make you a cozy counter spot that you don't have to look out the window. Sure we're getting fresh water. Good girl. You're so brave. Oh, very impressive. Very impressive. Okay. Oh gosh. Oh my goodness. Trouble. Okay, well that was not exactly as intended, but it's okay. Can you recover from this? Okay. Just take this towel, soak that up. Ooh. You're being very brave. Very brave. Okay. Another towel. Okay. So this will need to be washed. But I think we're good. And dustpan. You're very brave. Very brave. Okay. I'm just adapting the Lego castle to make it a little more useful for her. And now cleaning up a mess that I made in the process. That's what I do. Make messes. But that's okay. There we go. Okay. That looks pretty good. You've been very brave. The broom. Alright, I'm gonna leave the broom in here for you to smell. It's not that scary for you. It's not gonna get you. Okay, now. Alright, I think I need to clean this up. And there's one more. Okay, that's pretty good. Pretty good. Now, alright, let's see. Okay. Oh, ooh. Oh, I see. I did it. Oh, and I need a litter catcher. So good at making noises. Okay. Oops. Okay. Oh, I need one more. One more can. Okay. Okay. Now we've got that angle covered. And that's better. And then this one.